The first job that I took when I came to town was as a float pool nurse in the staffing registry of a local hospital system. It paid a bit more than a regular staff position, and I was really looking forward to the extra flexibility in my schedule. I was used to working on the same unit all the time, but since I had been a nurse for 8 years, I figured I'd be fine working in the staffing pool. So I joined the float pool. I was assigned to cover a variety of areas, and I knew that I might very well work a different area every single day. I might even need to switch between several different hospitals. But I figured that once I got comfortable with the basics of this new hospital system, being in the float pool would be no big deal. It turned out to be one of the scariest and most difficult nursing jobs I have ever done. I'd come into work on a unit I wasn't familiar with, and it would leave me feeling disorganized and disoriented. I didn't know where to find things, and I didn't know who anybody was. It seemed like even though there were people everywhere, I could never find quite the right one at the right time. Sometimes I'd get a bit of an orientation from the charge nurse, depending on how busy the floor was at the time.
Hello, I am Susan. I'll be charged today.
Hi, I'm from the float pool. I've never worked on this floor before. I'm wondering if you can show me around?
It will have to be quick. The break room is through there. The nurse's station is right there. You have rooms 7 through 12. I shouldn't be too hard to find. Call me if you need me.
Thanks, I appreciate it.
Sorry. We're still so short-staffed this morning. I've got to get going. 7th floor, charge speaking.
Even trying to figure out who the case managers were, which doctor was which, who was from lab, who was from respiratory. It wasn't always that easy. Often, people were just so busy that introductions had to go by the wayside. Sometimes the doctor for one of my patients might arrive on the floor, and since we'd never met each other before, his name tag might be turned around, and there was never any time for introductions, I wouldn't even know who he was until I read his name on the orders that he wrote. Sometimes the doctors would be in and out of there so quickly, I'd never even get a chance to talk to them.
I'm having so much pain. I need more pain medicine.
Go ahead and take this dose now. I'll talk to the doctor as soon as I can and see if we can get you a higher dose.
Whatever helps get rid of some of this pain is fine with me.
The dose you just took will help soon.
Dr. Anderson here.
Mr. Cruz. If you're ready, I can take you down for your CT scan.
I'm not sure I can be there so soon. I'll see what I can do.
Wait a sec! Don't go! That was Dr. Anderson, wasn't it?
It sure was.
Oh man, I needed to ask him about increasing Tom's pain medication. Now I'll have to try to find him again later. Hi, Dr. Anderson. I'm calling about the patient, Mr. Tom Cruz, in room 711. I don't think his pain medication is quite doing the trick.
But I saw that patient earlier. Why didn't you mention something then?
In the end, after all these frustrations, I didn't stay at that job very long. Working under such pressure, without really being able to communicate or work as a team with the people around me, it wasn't healthy for me. And it definitely didn't help anybody take better care of the patients.